Imagine having an infection in your body that slowly damages your reproductive organs, sometimes without clear symptoms. Many women don't realize they have it until they struggle with chronic pain, infertility, or serious health complications. This condition is called pelvic inflammatory disease, and millions of women worldwide are affected every year. The good news, with the right knowledge, most cases can be prevented or treated early. Today, we'll break everything down in a simple and clear way so you can protect your health or help someone you care about. What is pelvic inflammatory disease? Pelvic inflammatory disease, often called PID, is an infection that affects the female reproductive organs. These organs include the uterus, fallopian tubes, and ovaries. Normally, these parts of the body are protected from harmful bacteria, but sometimes bacteria can travel upward from the vagina or cervix and cause inflammation and infection. PID is most commonly caused by sexually transmitted infections, especially untreated ones. However, it can also happen after childbirth, miscarriage, abortion, or certain medical procedures if bacteria enter the reproductive system. What makes PID dangerous is that it doesn't always cause obvious symptoms in the early stages. Some women may feel completely fine while the infection slowly causes damage inside the body. That is why awareness is extremely important. Think of PID like a small fire inside the body. If it is discovered early, it can be easily controlled, but if ignored, it can spread and cause serious complications. What causes pelvic inflammatory disease? The most common causes of PID are bacteria that spread through sexual contact. Two of the main infections linked to PID are chlamydia, gonorrhea. These infections can live in the body without causing noticeable symptoms, especially in women. Because of this, many people don't realize they are infected and unknowingly allow the bacteria to spread deeper into the reproductive organs. Other factors can increase the risk of developing PID. Having multiple sexual partners, having a partner who has multiple partners, not using protection during sex, having a history of sexually transmitted infections, douching, which can push bacteria upward into the reproductive tract, recent pelvic surgery or procedures, being under 25 years old and sexually active. It's important to understand that PID is not a sign of weakness or personal failure. It is a medical condition that can affect anyone who is exposed to infection. Common symptoms of PID. Symptoms of pelvic inflammatory disease can vary from mild to severe. Some women have strong symptoms, while others have almost none. This is one reason why PID is often called a silent infection. Common symptoms include pain in the lower abdomen or pelvis, unusual vaginal discharge that may have a bad smell, pain during sexual intercourse, burning sensation during urination, irregular menstrual bleeding, fever or chills, fatigue, nausea. Sometimes the pain may feel dull and constant. Other times it may feel sharp and intense. Some women may ignore mild symptoms, thinking it is just normal menstrual discomfort. But persistent pelvic pain should never be ignored. Your body often gives warning signs when something is wrong. Listening to those signs can prevent long-term complications. Why PID can be dangerous? If pelvic inflammatory disease is not treated early, it can lead to serious health problems. One major complication is chronic pelvic pain. This pain can last for months or even years, affecting daily activities, relationships, and emotional well-being. Another serious complication is infertility. The infection can damage the fallopian tubes, making it difficult for an egg to travel normally. Even small scars inside the tubes can prevent pregnancy. PID can also increase the risk of ectopic pregnancy, which is when a pregnancy develops outside the uterus, usually in the fallopian tube. This condition can be life-threatening and requires emergency medical care. In severe cases, PID can cause abscesses, which are pockets of pus that form inside the reproductive organs. These may require hospitalization or surgery. The important thing to remember is that early treatment greatly reduces these risks. How doctors diagnose PID. Diagnosing PID usually involves a combination of medical history, symptoms, and physical examination. A healthcare provider may ask questions such as, when did the pain start? Have there been changes in vaginal discharge? Is there pain during intercourse? Are there any urinary symptoms? Have there been recent infections? The doctor may perform a pelvic examination to check for tenderness or unusual discharge. Additional tests may include vaginal or cervical swab tests, blood tests, urine tests, ultrasound imaging, pregnancy test. There is no single test that confirms PID in every case. Doctors often make the diagnosis based on symptoms and risk factors. Because untreated PID can cause permanent damage, doctors usually start treatment quickly if PID is suspected. Treatment options. Pelvic inflammatory disease is usually treated with antibiotics. These medications kill the bacteria causing the infection. Treatment may include oral antibiotics taken at home, stronger antibiotics given by injection, hospital treatment in severe cases. It is extremely important to finish the full course of antibiotics even if symptoms improve early. Stopping treatment too soon may allow the infection to return. Partners may also need testing or treatment to prevent reinfection. During treatment, doctors often recommend avoiding sexual activity until the infection is completely cleared. Early treatment is very effective in preventing long-term complications. Prevention. Protecting your reproductive health. The best way to protect yourself from PID is prevention. Here are practical steps that can reduce risk. Practice safe sex by using protection. Get regular health checkups. Get tested for sexually transmitted infections if sexually active. Seek medical care if symptoms appear. Avoid douching. Limit number of sexual partners. Encourage open communication with partners about health. Prevention is not about fear. It is about being informed and making healthy decisions. Your reproductive health is an important part of your overall well-being. Real-life perspective. Many women who experience PID say they ignored symptoms at first because they thought the discomfort was normal. Some thought pelvic pain was just part of the menstrual cycle. Others felt embarrassed to seek medical advice. But health professionals emphasize that early care makes a huge difference. Talking openly about reproductive health helps remove stigma and encourages timely treatment. Health is not something to be ashamed of. It is something to protect. When to see a doctor? Immediately. Seek medical attention quickly if you experience severe lower abdominal pain, high fever, fainting, vomiting, heavy abnormal bleeding, severe pain during intercourse. These symptoms may indicate a serious infection or complication. Early medical care can prevent long-term damage. Ignoring symptoms can allow the infection to worsen. Listening to your body is one of the most powerful steps towards staying healthy. Finally, pelvic inflammatory disease is common, but it is also preventable and treatable. The biggest danger comes from lack of awareness. Understanding symptoms, risk factors, and prevention strategies can protect fertility, reduce pain, and improve quality of life. Knowledge gives you control over your health decisions. Small actions today can prevent serious problems tomorrow. If you found this video helpful, subscribe to BalancedMotion Health for more simple and reliable health education. Share this video with friends or family who may benefit from this information. You never know who might need it. Leave a comment below if you would like more videos about women's health, reproductive health, or preventive care. Your support helps us create more educational content that empowers people to live healthier lives. Remember, taking care of your health is not optional, it is essential. Stay informed, stay confident, and keep moving toward a healthier future.